Hi everyone, hope you're well. Now we're going to be talking about vitamin K2, menaquinone 7, one of my favourite vitamins. I have a lot of favourites, but vitamin K2 is a big favourite. It's involved with calcium transport and calcium homeostasis. So it has a way of regulating calcium metabolism in the body. And one of the exciting factors it does, it reduces the calcification of the arteries or the vascular system and reduces or even prevents in some cases calcium deposition into the lining of the blood vessels. And that's something very exciting because as we get older, from the age of 15, they've found that there is calcification and atherosclerotic plaque in our vascular system. So vitamin K2 has a way of working with that flexibility of the arterial system. It's involved with the production and activation of osteocalcin, matrix GLA protein. So again, we're looking at a lot of carriers vitamin K2 works with. Vitamin K2 carriers, different spelling, you know what I mean. It works with essential components of coagulation and production of prothrombin and coagulation factors. So it keeps our blood running regular. So if you think about the bloodstream as being a beautiful river, the river is flowing through, and then you have this calcification and plaque formation and atherosclerosis and hardening of the arteries or stiffening of the arteries. It changes the blood flow and reduces the nutrient flow in the body and detoxification pathways. So I see vitamin K2 as a very good detoxification supporter in this case because it works with all those elements of regulating the blood flow via coagulation, regulating calcium deposition and removal and taking it back to where the bones, for example, where it should be, and the flexibility of the arterial system. So there's its regulation and reduction of arterial stiffening. It overall improves cardiometabolic health. That's the way I think of vitamin K2. Of course, people always think of vitamin K2 for bone metabolism, bone mineralization effects, and overall bone health. Couple that up with the magnesiums and the calciums and other nutrients as well for bone regulation. Vitamin K2 is like the director of these pathways, and that's what I find quite interesting. There's the way how it works. Vitamin K2 also has antioxidant, anti-inflammatory, and immunomodulatory processes and properties. So again, another nutrient involved with the immune system, anti-inflammatory, antioxidants. So a lot of these nutrients have multiple purposes in our body systems. So it's never just one. The other area that we're starting to find that's quite interesting with vitamin K2 is with brain health and brain signaling. So I find it, because I have a special interest in cardiometabolic health, mental health and cognitive health. And vitamin K2 seems to be one of the nutrients that bridges the gap in nutrition and a lot of processes needed for optimum cardiometabolic health, mental health and cognitive health. I find it very interesting, vitamin K2. So the question is, should everyone be having some?